Assalamu alaikum. I am Dr. Madiha Chang, working as an ophthalmologist in Sindh Institute of Ophthalmology and Visual Sciences. So we have arranged 6 days workshop for the PPHI Doctor District Matiari with the collaboration of CBM International. So our aim was to train our doctors about the direct ophthalmoscope. We have also teach them about the anatomy of the eye, normal anatomy of the eye, and also we have teach them about some common pathologies of the eye. So today I am here to explain the parts of the direct ophthalmoscope. So there are different types of the ophthalmoscope. One is direct ophthalmoscope, another is indirect ophthalmoscope. Today I am explaining you the direct ophthalmoscope. Okay, so there are 2 parts which I am holding here. One is hand battery which I am holding it. This is the battery and this is the headpiece. Okay. So in this battery part, this is the on and off switch. Just to press it and rotate it. Okay, press it and rotate it. This is the on and off switch. In headpiece, this is the examiner side and this one is the patient side. Okay, so first of all I am explaining you the examiner side. This is the dioptric power display. So here the powers of the lenses are shown here, and in this way we have to set the power. Okay, in clockwise the power are in plus number, and in anti-clockwise the power are in minus numbers. Okay, this is the brow rest and this one is the viewing window of the examiner side. Now the patient side. This is also the viewing window on the patient side, and this is the filter changer and aperture changer. Okay, so this is the overview of the direct ophthalmoscope. Now how to attach this head on this battery side, just to like this and attach it. Okay, to rotate this one and it will close remove from the battery side. Okay, now I am explaining you about the different filters and apertures and what is the uses of these filters and apertures. Okay, first of all I open this direct ophthalmoscope and see, these are the different apertures. This is a small aperture to see the pupil size. If the pupil size is small, I am using this small aperture, and this is the large aperture to see if the pupil is dilated and large, then we set this large aperture. This is the blue filter. Okay, the blue filter is basically used for the corneal abrasions, and also used to if we put on the fluorescence dye on the patient's eye, and then we see the lesions, different lesions on the cornea. This is the green filter. It is also called red free filter. Okay, you can see this. This filter is used basically for the vessels in the fundus and the retina, and also we use the cup disc ratio in this filter. Okay, and this is the green filter. It is also called red free filter. We use this filter for the to see the nerve fiber layer, and also we see the cup disc ratio for more prominently. This is the slit to see the anterior segment of the eye. This is the overview of the aperture and filters of this direct ophthalmoscope. I am showing you practically how to perform this direct ophthalmoscope on the patient. So there are basically some protocols before we start to this examination, there are some protocols. Okay, there are 3 steps to examine the patient. First, setting of this ophthalmoscope. Second, the patient's protocol, and the third one, the examiner's protocol. Okay, these 3 steps we should complete, and then we will examine the patient. And other protocol was to dim the light, and also ideally we put dilator drops, Medratic drops to the patient in both eyes, so it will be easier to see patient's posterior segment. Okay, and also, okay, the first step was to set this ophthalmoscope. Okay, to set this ophthalmoscope, basically there are 3 things we should examine the patient. First, we should see the red reflex, and other one, we should examine the anterior segment of the eye, and after that we should examine the posterior segment of the eye. So there are different dioptric power that we will adjust them, and then we will see the different things. Okay, another thing, we should ask patient to sit comfortably. Okay, and we also take consent and telling the patient about what we will do to that patient. Okay, and okay, after